Hello, my name's Ollie Morris and I'm a GP working in Southampton.
My name is Sally Hinder and I'm a health visitor working in Farnborough.
And in this video, we're going to be talking about abdominal pain or tummy aches in children and young people. Now, obviously, abdominal pain is a very broad symptom. There are lots and lots of conditions that can cause tummy pains in a child or young person. Most of them are not particularly significant, and there are a few common ones we'll talk about. A few are quite significant, and some are potentially very serious. So it's a very big topic, but what we hope to do in this video is just talk through some of the more common types of tummy pain you might come across and what you can do about them. And then towards the end, we'll return to some more significant things that you should look out for that might suggest that they need to have some extra help and need to be checked over by a healthcare professional. So let's start off with some of the common causes of tummy pain.
Okay, so if we start off from the younger age group, so there will be things that are quite common in very young babies, so things like reflux and colic. And these things can be managed, generally colic can be managed by just kind of being with your baby. A lot of it is around managing your own emotions with colic because babies can cry quite a lot, and that's normal. That's completely okay. There are some medications that you can use, but there's not a huge amount of evidence for their effectiveness. You can do things like baby massage, warm baths, skin to skin contact often helps with colic, but generally colic settles after about 8 weeks and you'll notice that the crying will reduce as well. Things like reflux, you'll probably want to look at the other pages on the Healthier Together website for more information about managing reflux because it really depends on the symptoms as to how you manage them. Things like tummy bugs, diarrhea and vomiting. Again, there is a page on the Healthier Together website about diarrhea and vomiting, what to do about it and how you can manage it. But generally, keeping up fluids. If babies are generally, children, young people, whatever age, if they're generally well, then they probably are fine and you can probably manage it at home. You can use things like rehydration fluids and that kind of thing. Urinary tract infections, wee infections, whatever you want to call them, they again also can happen at any age. Those sometimes you can manage with just drinking a little bit more, making sure that your child is properly emptying their bladder when they go to the toilet, because that can increase the risk of UTIs if they're not doing that. And then maybe sometimes if it is ongoing for a few days, where it is probably worth getting in touch with the GP just in case they need to prescribe some antibiotics for that. And also for any abdominal pain, you can also use paracetamol and ibuprofen to try and manage that too. Constipation. So again, it kind of depends on the age of the child, but generally you may well be able to manage it with diet. If it's just kind of something that's on and off with constipation, just make sure that your child is having plenty of fluid in their diet, drinking plenty, and also plenty of fruit and vegetables, lots of fibre in their diet as well, and that should help manage any constipation. But again, if it is quite acute, very painful, and an ongoing problem, then it's probably worth speaking with the GP about that one. As children get older, when girls do go through puberty, they will start to experience period pains, and this is probably going to be quite a new thing. It can be quite worrying for them, but again, they can just be managed with paracetamol, ibuprofen, hot water bottles, warm baths, and that kind of thing for those. And then recurrent abdominal pain, so times when it's potentially just kind of on and off, might have it for a few days, then it might go again, can be caused by a number of things. It might be that it's related to constipation. It could be that it's related to anxiety, if they're a particularly anxious child, or if they've got some exams coming up or something going on in personal lives that might increase their anxiety. And there are things that you can do to ease that. Talking to your child about anything that they're anxious about can help. Talking to the school, make sure that they've got support in school if they need it, if there's anything that's causing their anxiety in school. There are books that you can read with your child about how to manage anxiety. Generally talking to them about their emotions as well is really good, and may well help them to start regulating their emotions and understanding them a little bit better as well. But again, if it's if it's an anxiety that is worrying you, or it's not going away, then again, that would be something that you can discuss with the GP about managing anxiety, or it may well be that you can discuss it with the health visitor or the school nurse. And there are some really good website resources that you can access through this website or through the Health for Kids and Health for Teens websites as well. So generally, if your child is eating well, drinking well, might not be as much as usual, but generally they are taking on food and fluid. If the pain settles with pain relief, and if they're easily distractible from the pain with any kind of activities or anything like that, then they're probably going to be okay to manage at home with any of those things that we've just mentioned, depending on what's causing it. Okay, so now we'll just talk a little bit about when you might want to access further support in a more acute way.
Okay, thanks very much for that, Sally. So, as Sally said, a lot of those things you could manage in the short term at home, but one reason for seeing a GP or a nurse might be if these problems just keep happening quite frequently and they're starting to impact significantly upon your life and the child's life, and then it might be worth looking into it. So, constipation can be a bit more of a long-term problem and often benefits from a more, some time spent thinking through why it's happening and using laxatives to get it sorted out in the longer term. And it's true for some of those other conditions Sally mentioned. You might well want to see a GP, but not necessarily urgent right there and then when they've got the pain. What often causes concern for everybody, parents, carers, and doctors and nurses, are the more serious causes of tummy pain. So we're just going to go through those now. And because it's such a broad field, on this occasion I'm going to use the Healthy Together red, amber, green sort of traffic light system and work through them and just explain what's going on. So I'm just going to bring up that screen now. And here it is. So this is what you can find on Healthy Together. And we start at the top with the kind of serious things that you do need to seek some urgent help for your child. So this is going to be pretty unusual and you're going to notice it and you're probably going to seek help anyway. The first three are really just signs that your child is really unwell. Okay, so it doesn't tell you what's going on or what sort of problem, but it's just that a child's significantly unwell. So they're common to a lot of the red feature pathways. If they're particularly pale, floppy, not responding very well, they're shut down, so that means the circulation's not working well, so their hands and feet have got very cold and they're looking blotchy, unusual colour. They're not as alert and conscious as they should be, so they're difficult to wake or keep awake, or they're behaving in a drowsy way. Those are all concerning signs that the body's under significant stress. The next three are also looking at particular abdominal or gut problems. So if they're actually vomiting, and the vomit's not just normal, what they've eaten, tummy contents, but it's either a bright, vivid, greeny, yellow colour, we call that bilious vomiting, that can be a sign of blockage in the gut, or it's blood in the vomit. Obviously, blood in your vomit suggests significant bleeding in the gut, and that's not normal, and that could be potentially very serious. Sally's already mentioned about pain, so most of the less concerning causes of pain are going to settle with just a bit of time. The body's very good at sorting things out, or with simple painkillers like paracetamol and ibuprofen. But if the pain's persistent or it's very severe, that's a concern and you need to seek urgent help. And then particularly obviously in boys, there's a condition where the testicle can run into trouble if it actually twists on its own blood supply. We call that a torsion. So any boy that's got testicle pain or pain in their scrotum that's very severe needs to be checked out urgently, because that's a condition that can actually lead to the boy losing a testicle if it's not corrected quickly. So a boy with testicular pain or scrotal pain should be checked out urgently. So those are the red features. Now the amber features are obviously the ones where you would be advised to speak to a healthcare professional, a GP or a nurse, and may need a face-to-face review to either sort out a problem that keeps coming back or that might need some extra input and is not going to settle with the simple measures at home that Sally's discussed. So if we take the first one, obviously if they're getting significant swelling in their tummy, so it's not just a bit of a bloating feeling, but the tummy's swelling and swelling and swelling, and they're unwell with that and tummy pain, that could suggest a significant blockage. Now it might just be something very severe constipation, but whatever it is, it's going to need some treatment, and you need to speak to a healthcare professional for that. Again, blood is not a normal sign, whether it's in your wee or in your poo, and if you're getting that, then that's clearly something significant going on and needs to be checked out and see a GP or a nurse for that. I think if the pain's constant, so it's not keeps coming back, but it's actually a constant pain and it's going on for more than a day and it's not responding to painkillers, it's very reasonable to talk through with someone what's causing that and what you're going to do and how it's going to be resolved. The next one is here about a prolonged fever, or alternatively just symptoms that are going on for a significant period of time. And here we've put down 5 days. Fever is an interesting one because something like a tummy bug, you might get a bit of a low-grade fever with it, but if you get a significant fever, 39 degrees above, so a high fever, I think that's probably a good reason for being checked out in itself, because a fever with abdominal pain, the causes there are more limited and might benefit from some more focused treatment. Then we've got a child that's sort of quite different in the way they're responding to fluids. So they're either very thirsty all the time, or they're passing a lot more urine than normal, or alternatively, then have not passed urine for a long time. Now, the first two, being very thirsty and passing lots of urine with tummy pain, those could be features of diabetes, a new diagnosis of diabetes. That's why that needs to be checked out or discussed further. And obviously, if they're passing a lot less urine than normal, then you start to worry about how much, the hydration status of the child. Are they getting dehydrated? Is there a problem that kidneys aren't getting enough blood supply? Then we've got a specific sign of jaundice, so that's the yellowing around the eyes or general yellow in the complexion. You might be familiar with that, which can be completely normal and what we call physiological in newborn babies, particularly if they're breastfed. But at other times in life, it's not normal to be yellow around the whites of your eyes, and that can be a significant sign of the liver having problems. And that, together with tummy pain, certainly needs to be looked at in a bit more detail. And then this last one is a more kind of chronic problem. So you keep getting tummy pain, but actually the weight's not gaining as you should expect it to, or poor growth, or they're actually losing weight. That needs a think about why that might be happening. So those are the amber features, and for those ones, as I suggest, you either call 111 out of hours, or you ring your GP surgery and seek some advice from them. Okay, so that's the kind of red, amber, green bits. The green bits would be that you haven't got any of those features, and it's what Sally was suggesting, that actually things settle down, and it might be that you've got a hunch that this is constipation and you're managing it okay, or that it's a little bit of cystitis and is going to settle, and that's fine. But then again, if it's an obvious urine infection that's causing more problems and they've got a fever with it, then they almost certainly are going to benefit from antibiotics and should be seen fairly promptly. But if it was just simple irritation symptoms of cystitis, just going to the loo a bit more often, and they're an older child, they might settle in the same way it would for an adult, just drinking a bit more fluids and giving it a day or so for things to go away. The last one I'd just like to add in, so Sally mentioned obviously when girls get older and they go through periods, then obviously you can get period pains. It is worth bearing in mind that as soon as they're getting periods, if there's any chance that they're sexually active and having sex and they could be pregnant, that is obviously a completely new thing to think about, that if you've got abdominal pain and the patient could be pregnant, then that's really important that they get checked out and you go to see a healthcare professional for that. So I hope that was helpful. It might want to take some time and actually looking through the website and looking through those things, because we're aware that abdominal pain is quite a big topic, but hopefully that's given you some guidance to give you a bit of a starting point.